So we have Katrina here. She's 27 weeks pregnant, and we are going to teach her how to turn on her transverse abdominis, which is her deep core muscle, to help stabilize her pelvis because she's having a little bit of pelvic pain now that she's carrying baby. So one thing that you don't want to do is get a doming here in your core. So I'm going to have her demonstrate that by lifting her head. And you kind of see, if you come at an angle here, a dome kind of cone happening in her core. That is what you don't want to do when you're training your core if you're pregnant, because what is happening is your core muscles are starting to separate to allow for the baby to grow. And if you try to do a bunch of ab work, you're just going to kind of increase that abdominal pressure and continue to separate those abs. So we don't want to do crunches, sit-ups, things where you're flexing and getting that cone shape, because that's kind of not good for you or the baby. So we're going to have her contract her transverse abdominis, which is a deep core muscle, by cueing her to kind of just brace her back into the table and contract her lower core. And a lot of good cueing with this too is to do a Kegel contraction with that, so you're closing up pelvic floor as well at the same time. So getting a co-contraction there between pelvic floor and transverse abdominis. And as you can see, she's not coning when she contracts here. She's getting a little bit just because she's pregnant, but she's not getting that cone like she was when she was turning on rectus abdominis. So let's just give one more close-up of the difference between lifting her head and turning on a lot of rectus. She gets that cone shape. We don't want that. So relax your head and give a deep contraction, and that is what that should look like there. So now we're going to have Katrina do some pelvic tilts on a ball. So she is just rocking her pelvis back and forth here while still maintaining a nice flat upper back. So what you don't want to do is kind of round your upper back and show. You don't want to do that where you're extending through your chest and your upper back. You want to keep that nice and still and just see how her pelvis is moving. So this is a great exercise for anyone pregnant who is having some low back pain or pelvic pain, is really just getting that pelvic movement. She's also going to do a pelvic cluck, where she's going to kind of rock in a clockwise and counterclockwise pattern. And again, as she comes around, her pelvis is going to come up, and then her pelvis is going to drop back. So let's move this arm out of the way just so we can see that. It's dropping down, and then it's coming back. So again, this is a really great relief for low back pain, pelvic pain when you're pregnant. Then I'm going to show you how to use a yoga block. So putting a block between her knees to just do some isometric squeezes to kind of activate that pelvic floor a little bit. As we know, when you're pregnant, there's lots of laxity going on. The pelvic floor is stretching, the ligaments are stretching. So if we can get some activation there in the adductors and up into the pelvic floor, we can kind of help stabilize some of that pelvic instability that's causing some of the pain. So she's just doing squeezes into the yoga block with a nice neutral back. And then I'm going to show you how you can add a little bit of arm work to help activate the stabilizers of the lumbar spine as well.